Time now for this week's Health Matters. Paul Critz, along with physician assistant Lynn Szabo, and we've come back around. You said this feels or sounds like, or at first appearance feels like a repeat topic, but and you can't avoid these. It's a seasonal sort of thing. Healthcare.
Right.
Yeah.
Right. It's a good reminder, and there's new pearls in this. There's some helpful information, better ways to understand things.
The common cold.
Yeah, science moves on. So, like how to get through a cold or flu, more specifically. Okay. And this information came from my new favorite podcast called The Curbsiders Internal Medicine, which is for medical people, but, we all have access to it. Mm-hmm. But they do talk in our language. Mm-hmm. So, this specifically is number 457, cold and flu season upper respiratory infections. And the host physicians are Leah Witt and Molly Hublin. And interviewing internist, who's also a pulmonologist, we find out kind of at the end of it, Dr. Amber Bird. So also an academic, so she teach,es really enthusiastic group there. So
how many medical podcasts do you listen to?
Two, really.
Just two?
Yeah, just two, because I'm a quality person.
Okay,
and into the quality. These guys are great, because I personally can spend like an hour and 15 minutes listening to the finer details of congestive heart failure.
Sure,
they scratch that itch. So
that's really sweet.
It's usually two men. I think these are all friends from medical school, and but they're somewhat in private practice for a reasonable seasoned amount of time, but they all like hanging out together.
Wow.
Bright people.
All right, awesome.
Yeah. So an upper respiratory infection is what most people call the common cold.
And there's myriad different upper respiratory infections to get.
Yeah.
It's not just one illness, right?
I've taken to calling them rhandovirus in the clinic.
Okay.
So you don't have RSV, you don't have flu, you don't have COVID, it's rhandovirus.
Is there any sort of indication, just ballpark, like how many different kinds of respiratory infection? I mean, we've got the ones we know the names of or that we give names to,
right.
But is it just an amorphous glob out there of any?
Yeah, but it's also constantly shifting, right?
Right. Yeah.
So it's hard to put a number on that and not have it be immediately out of date.
Right, exactly.
Yeah. But I have seen panels done on people at Sutter that had about 35 or 40 different viruses that they were evaluating. And
wow.
Not sure the clinical value of that.
Right.
So I just call them all rhandovirus.
Yeah,
okay. So most people start with a sore throat, then they get congestion and cough. And then sometimes fever, body aches and headaches, sometimes, but rarely, nausea, vomiting, and diarrhea. So the cause, as we've stated before, is viral. So antibiotics don't work for this. Mm-hmm. And influenza, which is one type of viral upper respiratory infection that tends to be a lot nastier, that usually make people more miserable, and they're associated with high fever, significant body aches, and headaches.
Mm-hmm, mm-hmm. Is it just a matter of there being just the magnitude?
Yeah.
That's it?
I think it's more likely to kill people in the long run, so slightly more dangerous influenzas, slightly more dangerous group of viruses. And I also think the immune system responds more vigorously to it. And so that's why you get the body aches.
That's why you get more.
You feel prodromal.
Sure. See, we're talking about like the same, it's kind of just the same sort of a catalog of symptoms, right? That you experience. So it's so difficult to remember, I think, and I have a hard time, and I know this to be, but that what you're experiencing isn't the illness. You're experiencing your reaction,
your immune
to the
response.
Yeah.
So the difference that I look for when I'm trying to think about just rhandovirus to influenza is body aches. Body aches are intense. In influenza, people are miserable, and also degree of fever, no pun intended. So colds have maybe their temperatures around 100, 100.5. Flu, it can go up to 103. It's miserable.
Okay. What about, so the body aches, what are the body aches telling you?
that your immune system is freaked out.
Is freaked out. Is it?
Yeah.
So and freaked out, and what sort of? I mean, is
It's cranking up the troops.
Is it inflammation that's making things hurt?
An
Is that what
inflammatory response.
Okay.
Yeah.
Okay.
If you want to be specific.
I did.
But
I wanted to be specific. I appreciate.
That's why
the
some
color.
people who get a good immune response after an immunization talk about body aches. It's the
Right.
same troops being called for.
Yeah. Yeah. Okay.
So,
Gosh.
So-
Oh my God.
So for a cold, expect to be sick 2 weeks. And most providers would suggest you stay home and stick with conservative care. And I'll introduce a new term that I don't think I've explained before, but watchful waiting. Mm-hmm. So paying attention to your symptoms, not necessarily acting on them, but looking for signs and symptoms of concern.
And watching for them getting worse, right?
Right.
Is that's your concern?
Yeah.
Sure.
So that's not doing nothing.
What's conservative care mean?
Conservative care, we're going to talk a lot about later on.
Okay.
But beginning conservative care at this point when you're thinking, oh, man. So that's rest, that's fluids, that's making sure you get your sleep, that's maybe taking a sick day at work, low-keying it.
Yeah, just not pushing anything.
Yeah,
Yeah.
not
Okay.
pushing
Okay.
it.
Okay.
Okay. And then if you have comorbidities like diabetes or something, making sure your sugar's in a good space and all that. Okay. For the flu, though, so for a cold, you just kind of stay at home. It's going to last 7 to 14 days. Doesn't really matter what you do. But for the flu, within the first 48 hours, we can help you as medical providers. So if you got a high fever over 101.5 and, body aches and headache, you can come in within the first 2 days of onset of fever, and then we have an opportunity to get you on antiviral medicine if you're right about your diagnosis. Okay.
And this is something that it's COVID that hit me to the fact that was even possible now.
Yeah.
That antivirals were that widely
Right.
available.
I think when we had tools, then all of a sudden we had better diagnostic. When we could actually do something that was specific, then we were given the tools to diagnose more specifically.
Gotcha.
Yeah. Okay. So any symptoms that scare you, you should come in, like shortness of breath or loss of ability to taste or smell, which is a COVID thing. And that's also a reason to come in sooner. Or if you have comorbidities, like somebody's unfortunately going through cancer therapy and they know their immune system isn't doing well, come in sooner. But here's the crux. Home care for upper respiratory infections. I thought I would address that because this podcast talked about new understandings, ways to use meds that we used to not use that are not now helpful. So the message was don't use it, don't use it, don't use it. Now, maybe you should. Okay. And then, when I walk down the cold and flu aisle in Safeway, I think it's hard to figure out what's what. And patients will talk to me constantly in brand names, like that's meaningful. But if you read the ingredients list, they're all pretty much different mixes of the same 3 or 4 drugs.
Right.
And maybe not even in therapeutic dosages for like an adult. Say the amount of acetaminophen is pretty minimal. So let's talk about that.
Okay. All right.
Okay. First of all, some people think that their expectation is that over-the-counter meds are supposed to be curative. And they'll say that a lot, like, well, I took Alka-Seltzer Plus, but I'm not better yet. It's not what the Alka-Seltzer Plus is for. It's for keeping you comfortable, not necessarily curing you. So I think we need to understand that. They're meant to make you less miserable while you're waiting the infection out. Okay? And read the labels. The next important thing is read the labels.
You say read the labels. So what are you talked about the basic, the 3 or 4 things that are just mixed differently. So what, dextromethorphan, and what are the other things that get, I'm trying to remember because I've looked at those.
The first one is acetaminophen, which is Tylenol, right?
Sure.
And some of the cold preparations have a teeny little bit of it. And they're expensive. Let me all say that. These brand names are expensive. Even the Safeway Same As knockoff is expensive. Why would you pay more to get Tylenol that you have at home?
Right.
I don't think people realize that.
I see what you're saying. I mean, you've got a lot of these things already at home, so why
Right.
pay for this? Okay,
Right.
okay. I don't have a bottle of dextromethorphan laying around, though.
Yeah, that almost doesn't exist. Just plain dextromethorphan. So specifically, if I would skip anything as acetaminophen or ibuprofen because you
Okay.
already have it.
Right.
Next, if you're looking for an antihistamine or decongestant, this is a pearl.
Okay, okay.
Make note. Oxymetallazone, aka Afrin, I think is a brand name. Maybe
Okay.
nobody knows noses like neosynephrine. Might be that too. Medicine has traditionally seen this drug as a problem because people use it more than 3 days and they become habituated to it, and there's a rebound problem with it. But now they're saying 3 days for a cold is a great idea. And the best thing about it is, you stuff it up there, do 2 squirts, and you're immediately better.
Right, right. Yeah.
Yeah, it works really, really fast. And what they cautioned us on this podcast is it's usually immediately effective, but spray toward the middle of your nostril. Because if you're tasting it, your aim is off.
Wow. Okay. All right. That's a good tip. I know that. Yeah.
Yeah, they said if you're tasting it, you're wasting it.
You're
That was cute.
because it's just running down the back of your throat. Sure.
Yeah.
Okay.
Okay. And then consider cetirizine or loratadine. So that's cetirizine is Zyrtec and loratadine is Claritin.
Wow. Okay.
With or without pseudoephedrine. Okay.
Which is just a decongestant, right?
Yeah.
Yeah.
So cetirizine and loratadine are antihistamines, and Sudafed is a decongestant.
Mm-hmm.
And this is more likely to help with symptomatic relief.
Okay.
Okay.
Sure.
So it's not curative.
But there's nothing that can you buy anything in the down the drug aisle and Safeway that's curative in this regard?
Only preventative.
Right. Right.
A flu shot. So the next thing is intranasal fluticasone, which is Flonase.
Oh wow. Okay.
That's a steroid, intranasal steroid. And that actually they said was of marginal help.
Mm-hmm.
So that's going to change the way I prescribe because I'm a big fan and now it's not really super helpful, they said. But for some people, it might be their thing. Or a neti pot. Neti pots are always recommended, especially by infectious disease doctors, but
I can't do that.
I can't do that. I can't go there. But this is not thought to offer drastic improvement. But some people really like neti pots, and if it works for you, great. So a word about the last one isn't decongestant. It sounds like Sudafed, but it's not. It's oral phenyl. Oh, God, I'm not even certain I can say it. Oral phenylephrine. This has been shown to not be effective
Okay.
and possibly dangerous to some people.
Where do we find that?
It's your random combination
Just throw it in,
under a brand name.
Wow.
Okay.
Wow. Okay.
Especially if it says helps decongest.
Mm-hmm,
Okay. And this is often slipped, I just said that, into combo meds, kind of under the radar.
Wow.
So it's known not to work. It's known to cause harm. And I don't even know why it's still on the shelves.
What is it again?
Phenylephrine.
And okay, so
I think it showed up about the time that Sudafed or
ephedrine.
went over the, back to the pharmacist
Right.
in a locked area. This is kind of an attempt to have a similar decongestant more available, but
Okay.
it doesn't do anything.
And it does harm.
It does harm.
Do you have any idea what kind of harm that is? or-
Stroke. It's
Wow.
a risk for stroke in
Wow,
women.
okay.
Yeah. So this is why reading labels are super important. Now the next thing close to my heart, cough.
Okay. All right. Are we still talking about
Congestion drugs? No.
No. Okay. So now you went through Well, maybe this isn't, and hit me if this isn't the place yet to go with this. But you went through like a list of this is good and here's the name brand. This is good and here's the name brand. Sort of tearing apart those combo drugs and saying this is what these are the pieces of, and here's how you can secure those pieces more cheaply. I want to go over that again.
Okay.
So I don't know if we've reached that point to recap that information.
I'd be glad to recap it.
Because it sounds like with just a few common over-the-counter purchases, you can kind of have your upper respiratory infection needs, at least as far as the medications you need to lessen the symptoms as you wait out this viral infection. But you can have those things just kind of always on hand in your medicine chest.
I think most people have Tylenol and ibuprofen.
Right. But I don't know
most
if
people have Zyrtec and certain Claritin, so cetirizine and oh God, what is
I
it?
don't see. That's the thing that I'd like
Okay.
to have is to have whatever the Zyrtec or the Claritin or something like that.
Cetirizine is preferred, but Claritin is me.
Okay.
But the change here is the oxymetazoline, because we've been telling people not to have it for so long that if you look at the number of cold medicines that are the combination of these four things, and then look at what's solely nasal spray with oxymetazoline, aka Afrin, that's just a little down on the bottom in the corner.
Yeah.
I don't think people have that, because we've been telling them it's bad for a long time.
I grew up with a dear relative addicted to 4-way nasal spray in the 70s, right?
Yeah.
And so like when I think of nasal spray, anybody uses them, my first reaction is, oh, don't use that.
You can, but here's the caveat: only for 3 days.
Exactly, and that's perfect for use, and if you come down with the cold.
Right.
So yeah, that would be something I'd have to remind myself.
And if you particularly do well with cetirizine and say pseudoephedrine, there's no problem with continuing that. But specifically, do not get oral phenylephrine.
Right.
Yeah, that's a problem.
That was the okay.
Right.
So
and it isn't a lot, especially I see it a lot in cough syrup. Yeah.
well, yeah, because they were filling the hole since they had to stop using ephedrine, right?
And so I put that one back, and it's usually like some kind of product that says non-drowsy, good for daytime.
Okay.
Now, get into cough.
Yes.
Post-viral coughs linger. Okay, they just do. And some people cough. The infectious disease guys say coughing up to 5 or 6 weeks is considered normal.
Wow.
Yeah. And they have no compassion. But I think the best thing for cough is guaifenesin. Okay, and there are a lot of cough medicine is a combination of guaifenesin and dextromethorphan. Guaifenesin is a mucolytic, so what that does is it makes the mucus thinner so that you can get it up with 2 or 3 coughs instead of like 17 coughs. Okay. And then the dextromethorphan is kind of an antihistamine, and it's probably better for nighttime use. But what works better is the guaifenesin. And what I used to look for is pulmonary expectorant on the label.
Okay.
Because that's what guaifenesin is. But it's in a lot of different brand names. Would be Entex is really Mucinex is another common one. Dextromethorphan, these physicians called it meh at best. So it doesn't really help. It does make people sleepy. Maybe it's okay at night. Okay. And patients ask all the time, should I be taking the guaifenesin, which they know is a mucolytic, and the dextromethorphan, which they know is advertised as a cough suppressant together? Because that seems pointless.
Counterintuitive. Yeah.
But apparently you can. It's not a problem. Okay. So that's for cough. Other things that I do for cough, sometimes I'll give somebody an inhaler. I was trying to keep away from the prescribed stuff. And sometimes I'll give people what's called Tessalon pearls, which is known chemically as benzoate. And then sometimes I'll give somebody like promethazine with dextromethorphan. which is very close to what used to be called the purple drink, but not quite with the same street appeal. So people get excited and then, So I think people should sleep, and I don't think they should be coughing. This particular podcast said that they didn't think that inhalers were super helpful for people with post-viral cough unless they had a comorbidity of like COPD or asthma. So I use them more commonly in that, and that might change my prescribing habits to raise them in, or bring that in a little bit, not use it as often. But the way I'm going to make that decision is if somebody lays down and they start coughing and they can't sleep unless they're sitting straight up, I think that's when an inhaler is going to be important.
Okay. I like so your characterization of all of this, like you think that people shouldn't cough and they need to sleep and
at
not
nighttime.
cough.
And then during the day.
So the sleep is all you were saying is the coughing is the side.
Right.
That's what's keeping them awake. It's important that they sleep. Yeah.
We're counseled to remind people that coughing is good after a viral syndrome, that it brings up all these, kind of dead cells and, clears the battlefield.
Sure.
But really,
sleep is better.
But sleep is good at times.
Yeah.
So in my opinion, what you cough up, what color it is irrelevant except for blood, the presence of blood.
Okay.
So people always want to tell me about green sputum, or they bring it in for me to look at, or they have a picture of it, or because we trained them for a while to think that green sputum means the antibiotic.
Right.
And so that they're all very diligent now, but I go, oh, is there blood in that? No, okay.
No, all right, I don't need to see this.
Yeah, we moving on. So there is one exception that somebody with known COPD, if they're coughing up thick yellow stuff or green stuff.
That's bad.
That might be an antibiotic moment. So prepare to cough for a long time is the take home on that. So home remedies. I liked it. They talked in detail about this, and I think all these women are young mothers too, because they talked a lot about kids. Remember that placebo counts.
That's
you can
true.
get a 30% positive response rate, even if it's placebo. Okay, and so things like my mom always had me drink 7-Up, or we used to always do something with vitamin C in it. Right. That's fine. It may not really be what's helping you.
But
I
30% of the time it can.
Yeah,
right?
you can get some mileage out of that. I myself, whenever I get a sore throat, I try and eat a couple of tangerines or something with a vitamin C, not a pill, but actually a food heavy in vitamin C, and it makes me feel better.
Right,
I don't know why.
So because I want to see you've got you do mention the vitamin C connection, and I've got. Because there's no, and correct me if I'm wrong, please. I don't know of any sort of studies that indicate that vitamin C and massive doses of vitamin C at the right time do any sort of anything for viral infections, right?
Not really.
But it can make you feel better.
It makes me feel better.
Which 30% of the time is all you need.
It's what my mom used to tell me
exactly.
There you go.
Exactly.
Yeah.
That's beautiful. That's a very poetic sort of thing. That's wonderful.
Yeah, or chicken soup, or whatever your family's sick ritual is can make you feel better.
Right.
Honey, a simple home remedy, likely best for kids over 2 years of age, because kids under 2 years of age, there's a botulism risk.
Oh, okay.
That's kind of surprisingly hard to get down, kids. So if you bring out the honey bear, because your kid's coughing and it's 11:30 and everybody has to go to bed, and you put a teaspoonful in their mouth, that they hate that. It's too sweet.
Really? Wow. Okay.
And so the recommended get around for this is buckwheat honey, because apparently it isn't as sweet and it goes down easier. But the kid has to be over 2 years old, otherwise it's not good. Green tea, this was new to me. Green tea recommended for viral infections. And there's some data actually to suggest it helps colds be less intense and not to last as long. And the days that they quoted was a day and a half. So for reference, we're all about giving people Tamiflu when they have the flu and they come in at the right interval.
Right.
That makes the symptoms less intense and the length of illness lessened by a day and a half.
Same as with, wow.
Yeah.
That's beautiful. Okay.
Yeah.
And the same thing. I mean, so lesson by day and a half. Do you know, I mean, just anecdotally, if you hit green tea at the right time at the beginning of is it the same sort of thing?
Yeah.
That's why it's interesting.
It seems to be more effective. Or not more effective,
but
equal in effectiveness. And then zinc, of course, we did a lot of zinc in the early COVID days. Almost every provider I knew was on zinc, even though we poo-pooed it before and we'll poo-poo it again.
Yeah,
That's mostly what airborne is, although it's got some other things in it.
Right, and people swear by airborne.
Oh, they swear by it. But again, you can 30% out of placebo.
There you go.
That's fine. Okay. And then topicals for kids like menthol and eucalyptus topicals are helpful. So that's actually in the Hispanic community. They put Vicks Vapor Rub on kids' feet.
Can't stand Vicks Vapor Rub.
I
could never do that to
I don't
my
know why
children.
that works, but that's what their grandmother swears by.
Wow.
Yeah.
I had my mom. I'm sorry if you're listening, Mom. I'm gonna. She put Vicks Vapor Rub on me when I was a kid, and then put a T-shirt on me.
Right.
So I had this T-shirt on with the Vicks under it, and had to sleep like that.
Right.
It was the most horrible experience of my childhood. I could not bring myself to do that to my kids. No vapor. We are not a Vapor Rub house, and it took some convincing with my wife.
There is some data. She might be a little bit right.
I don't care.
You don't care?
It's the opposite of the placebo effect at that point. This sucks so hard. I'm going to get sicker.
I'm going to show her.
I'll show you.
Now, remember, vulnerable populations, kids get a cold about once a month.
Wow, really?
Especially younger kids.
Wow.
So like preschoolers and kindergartners. And so by May of this year, I'm going to have frantic mothers demanding immune competency testing for their children because, oh my God, they've had a cold once a month. And they're just over it. They're afraid and they're tired and they want the kid to be better. So, but most pediatricians just say, well, that's kind of expected at this age.
For the kid to be better, the kid has to go through this, right?
Right,
Yeah.
exactly. So that's kind of a bummer. But I think there should be more community support for parents of young children. I wish it was more of a cultural thing that we could facilitate parents in their care of a kid who is known to be getting sick once a month. This is an expected thing,
right.
And not, give them hassles at work and stuff like that. I mean, if our children are the most important thing in our lives, then we should treasure them.
Well, we don't need to start the Health Matters hypocrisy episode right now this
What?
week. Oh man, that's so. Oh gosh, I just remembered. What's the date? It's the 10th of. It's the 10th of November already. We're recording this, and I and my wife had both promised that the 1st of November we were getting our COVID and our flu shots, and
going for denial.
We didn't. No, we just forgot.
Oh
no!
Really?
So yeah, when she's back, we'll go do that this week.
Okay, go to the CDC flu site, the flu week, and you can look at the map of the United States, and it's already on the East Coast. By the time Thanksgiving happens, it's going to blow up here.
Wow.
Yeah.
Okay. All right.
Okay, so consider your own particular comorbidities. So if somebody knows they have lung disease like asthma or COPD, or kind of an endocrinopathy like diabetes, or some kind of immune dysfunction, then that might change how you access medical care.
Right.
Your physician might give you particular signs and symptoms of concern to look for. Like, for example, somebody with asthma, if they're using their rescue inhaler more than twice a week, that means they need to go in because they're in trouble. Okay, so your provider should be able to give you more like personal signs and symptoms of concern for you other than the generalized ones.
Right.
Yeah. And then my favorite, immunization, because when you see somebody who comes in with the flu and you say, gosh, when did you get your flu shot? And they just look at you. I'm sorry.
Yeah, yeah.
This is the consequence of that.
And now you're going to just go through this, and however
Yeah.
bad it's going to be that bad.
Yeah.
Yeah. Yeah.
So I hope this helps people figure out what to get.
It reminded me that
Yeah.
I have to go get the
Totally,
immunization.
because I will have no sympathy for it. So,
And then, I've got a good idea then as far as what to keep in the medicine cabinet now.
yeah, what to look for. And you might be buying 2 or 3 different kinds of meds, but it's better to do that than it is to spend a lot more money on a combination that's not therapeutically dosed.
Right on.
Okay.
All right. Lynn, thank you very much. Very informative, very, very timely. We'll talk again next week for the next Health Matters.
Alrighty.